All right, it is officially 7:05, and I want to be a good steward of everyone's time. So I want to thank you all for joining. My name is Cynthia Brooks Nickerson. I am a captain of the health and wellness team for the LA South Chamber of Commerce. This webinar is brought to you by the LA South Chamber of Commerce, and we have many teams that speak to all kinds of interests. So if you're at all interested in being part of a chamber to help your business grow, please check us out. We're online at lasouthchamber.com. All right, this webinar is about Medicare, and I'm happy to introduce our presenter for the evening. That would be Vanessa Aaron Seymour. So Vanessa, I will allow you to take it away.
Okay, thank you, Cynthia. It is a real pleasure to be here, and want to thank everyone who is currently participating. I represent one half of Seymour Insurance Services, and we have a running joke between the two of us. It's a cat and dog production. So, as he slides me over, so what we're going to do is I'm going to let Cliff do all of the introductions, and then from there I will take it over for when it comes to talking about the actual cost of Medicare. So I'm going to slide over and let him.
Okay, yes. Thank you everyone for joining this evening. So let us go ahead and get started. So we're Seymour Insurance Services. This is our website. If you look up here at the top, it does say myhealth-wealth.info. That is our website. And a little bit later on in the presentation, you'll see where that kind of fits in. That was Vanessa's idea at 2 o'clock in the morning several years ago about health and wealth being something that is joined together. So we're speaking of Medicare tonight, and these are the different carriers that we are appointed by. We basically are contracted with all of these companies, and we provide services through them, all their different plans. And every year we go through certification through Medicare and learn about the new plans, so we're able to compare all the different plans and see what's the best fit for everybody. So tonight we're going to talk about the roadmap to clarity, because Medicare is very confusing, and what Vanessa's going to go over is like what is Medicare, how and when do I qualify, and there's a lot of confusion about Medicare versus Medi-Cal. Then we're going to look at the economics, which is the core topic tonight, about cost. And then there's a strategy. You have to look at how you're going to get your Medicare, and if you're dual eligible, which we'll go into, maybe also Medicare and Medi-Cal. So that's what you have to have a strategy on. How are you going to get your health care?
All right, so I'm going to slide right in here now. And let's talk about what is Medicare. Medicare is a federal health insurance for anyone age 65 and older, and some people under 65 with certain disabilities or conditions. Now, let's say, for instance, you're a young person and all of a sudden you've been working for X number of years, and either you contract an illness or a disability that render you disabled to work. Believe it or not, there's a lot of young people under the age of 65 who have Medicare. Another example is, let's say, for instance, as you get older and you become Medicare eligible and you have a disabled offspring, as you become eligible for Medicare, your disabled offspring also becomes eligible for Medicare. How is Medicare funded? Many of you, if you could remember when you had your first job and they told you that, okay, I'm going to give my age away. When I first started my first job, it was $2.10 an hour. So when I got my first paycheck, I expected to get every penny from that $2.10, and all of a sudden I saw this theft that was sitting on my payroll. It says FICA. I said, who is FICA? I'm sharing part of my income with FICA. Well, believe it or not, at that early age, I started to plan for my future. FICA actually helped plan for your future, especially in the area of health care and retirement. Part of FICA goes to Social Security, the other portion goes to Medicare. In this case, you are paying for your Part A. So when you see a deduction from your payroll check and it goes to FICA, you are paying for your Part A benefit. Currently, if you're employed, your employer pays half of your FICA. You pay 1.45% from your earnings and your employer matches you. If you are self-employed, you pay the whole thing, 2.90%. Now, sometimes self-employed people feel where this is really eating into their profit margin, so they might kind of skirt paying self-employment taxes, but in the end, it can cost you. So, let's talk about how do you qualify for Medicare? So you are eligible for Medicare if you are, number one, United States citizen or have been a legal resident for at least 5 years and you are the age of 65 or older. Now, if you have not paid into the system, you can actually piggyback off of your spouse's history. A lot of people are self-employed and one of the spouses works, so their time and quarters go towards your benefits as well. So the magic number is 40 quarters. So you might hear, well, I got my 40 quarters in, I'm good. But what I'd like to just kind of break down, what is a quarter? So 1 quarter is equal to $1,890. Last year, it was $1,810. That's per quarter. So if someone works and earn at least this amount, they only qualify for 1 quarter. In order to max out your 4 quarters for that year, you have to make $7,560. So someone who makes $6,000 in a given year, they might have worked for 12 months, but guess what? They're not getting those 4 quarters. And when I go into places like Walmart and I see greeters and they're older age, sometimes they're trying to catch up on those quarters. So you need a total of 40 quarters to be eligible for your retirement, which is Social Security or Medicare. Now, what happens when you turn 65? There's a couple things that comes into play. Okay, if you are currently receiving Social Security by the time you turn 65, you do nothing. The Medicare card comes into the mail automatically 3 months before your 65th birthday. I get this question all the time. Well, what if I'm working and I'm happy, I have no intentions to stop working? If you are covered through your employer's plan and you intend to continue having that coverage, you do not have to apply for Medicare. However, if you are going to continue with your employer's plan, you have to make sure that the prescription drug benefit that the employer provides is equal to, if not better, what you would get through Medicare. That's the one thing that they look at. Okay, if everything adds up, you don't have to do anything. Or if your spouse is carrying you on their benefits, the same principle apply. Now, there might be some pushback if the employer is a small employer or have 20 employees or less. you might have to get Medicare. So those are conversations that you have to have with the employer. If those two scenarios does not apply to you, then the last button might apply to you. If you are not receiving Social Security benefits or covered by an employer's coverage, you have 7 months to apply for Medicare online or in person. And Social Security now is really encouraging you to do many of these things online, to the point where they even have videos online showing you how to establish a presence with socialsecurity.gov. You can apply for your retirement. You can apply for Medicare. In fact, about 3 weeks ago, I helped one of my clients establish his Medicare request, and 2 weeks later, he had his Medicare number. I was able to enroll him. He never stepped foot inside of the Social Security office. In fact, they're becoming fewer and even more difficult to get appointments with Social Security. So this is just a little diagram so that you can visually understand what that 7-month window looks like. So 3 months before your 65th birthday, you can start this process. You have the month of your birthday to begin the process, and then you have 3 months after your 65th birthday. Now, couple things. What happens on the 8th month if you decide to get serious about applying for Medicare? 8th month, guess what? Game over. You will have to wait until what they call it's the annual enrollment period. That begins January 1 of March 31st of every year. That is not a good position to be in, because what you're going to do is going to incur a penalty. So if you became eligible for Medicare and your 7th month was up sometime in April, that means that you have to go through April till about February of the following year, and that penalty will start to accumulate. Now, this is it's fortunate and it's unfortunate at the same time. What you have to be aware of, that there is a cost for Medicare. You paid for Part A when you were working. Okay, when you become eligible for Medicare, A is paid up. Now you have to pay for Part B, and not everyone pays the same for Part B. So if you're fortunate to be a high wage earner, Medicare can cost you a little bit more than perhaps your neighbor. And what I discourage people from doing is talking Medicare costs to their friends and family, because they could get the wrong information, because this is very customized. Because what they do is they look at your income for the previous 2 years. If you fall into what they call a higher wage earner, your Part B premium could be higher. Okay, so I have to apologize for the diagram. It's not the clearest, but I wanted to give you something visually to look at. So if you are an individual, okay, in 2024 you made $109,000, then or less, you would then be eligible to pay the standard of $202 for your Part B premium. This is a monthly premium that you are expected to pay. So if you're currently receiving Social Security, it's automatically deducted from your benefits. If you are not receiving Social Security, which is typical in this environment, because the full retirement age for anyone who was born after 1960 is 67 years of age. So Medicare is 65, full retirement age is 67. So there is a 2-year gap there. So if one can afford to, many people are deferring their Social Security until their full retirement age. So if that's the case with you, what's going to happen is you get your Medicare card, and you get a quarterly billing statement saying that the $202 would be multiplied by 3, which is approximately $606 you'd be looking at paying quarterly. The same apply for a married couple. That income is double, $218,000 of income. They would still be eligible for the $202. However, then it is tiered between $109,000 and $137,000. You'll start to see the Part B premium goes to $284.10, and then there's a little extra something. You also have a surcharge for your Part D. Part D covers your prescription drugs. So you add those two together, that is what your additional cost would be. And then it goes even further. The higher the income, the more you pay for Medicare. Now, you would say, well, what are they judging? Is it judged on my adjusted gross income? No, it's not just on adjusted gross. It's a term called modified adjusted gross income. So often we have deductions from our gross income that creates the adjusted gross income. Well, a lot of those deductions that we use for tax purposes to lower our taxable liability is the adjusted gross income. With IRMA says, nah, we're not going to let you have all that stuff right off. We're going to limit what we allow you to write off, so that when you are evaluated for IRMA takes a look at the deductions that you might have used for writing off your car and depreciations and all that good stuff. Guess what IRMA says? You got to put that back. Okay. And that's how the MAGI is calculated. In order to adjust your MAGI, they look at making contributions. There's a list that I can provide, but one of the things they look at is charitable contribution and tax deductions that you use for funding retirement accounts. They allow that to go into the MAGA when it comes to IRMA. Now, once you get over this hurdle, let's say, for instance, now you are paying into the system, you have Medicare and you have Part B. And all of a sudden, and this happened to one of my friends, they decided that they wanted to remodel their kitchen, and they had enough money. They didn't need to go into any kind of financing situation, so they tapped into a 401k. And when that 401k hit their tax returns, guess what? They met Miss Irma. So you have to be very strategic even after you have established Medicare. The IRS and Social Security have conversations, and those conversations are not good for you, because they look at your taxes to see if you are at least 1 year that you hit this chart. And now you have IRMA, and you might not have had IRMA 1 year, but because you dipped into certain accounts or you had required mandatory distributions, it could hit IRMA. So IRMA is always out there waiting to attack. Now, when you look at Medicare, there is a building block towards Medicare. Okay, and this is kind of reverse. We're going to start with the bottom and kind of go up. So when you become eligible for Medicare, there's Part A. A is what you pay for during your working life. Okay, that's the 40 quarters you paid into it. And what it covers like in-hospital stay, skilled nursing, and hospice. That comes out of Part A. Anything outside of that environment goes to B. B is like when you see your primary care doctor, any specialist, if you have to have any kind of physical therapy, all that comes out of B. So when you get that little red, white, and blue card, you are good to go with all of that. But there is a cost to it, which I'm going to explain a little later. Many of you have, if you've listened to the television, you cannot avoid hearing this. Part C. Well, Part C includes A and B, and it also includes your prescription drug plan. I always like to say a Medicare Advantage Part C means it's comprehensive. It has everything. What Medicare does not provide you with A and B is Part D. That's your prescription drug plan. Back in 2006, Congress became a little mindful of how they can squeeze a little bit more money from the Medicare beneficiaries. Prior to 2006, prescription drug plans was also included with Medicare. So it's a carve out. So in order to get your prescription drugs, whether you do nothing, you have to get a standalone prescription drug plan unless you get a Medicare Advantage plan. And those Part D plans are becoming very, very costly. Now, I've run into some people that says, I'm good, I'm healthy, I don't take any drugs, so I'm going to decide not to get Part D. That's a bad decision, very bad decision, because penalty. Someone who says they're in good health, they're going to decide not to get Medicare. Bad decision, penalty. So there is some clarification that I want to make a distinguish. Sometimes people get Medicare and Medi-Cal confused. Okay, Medicare is a federal program for individuals 65 or with specific disabilities. Medi-Cal is based upon a financial need. It is a partnership between the state and the federal government. And Medi-Cal covers individuals, families, and in particular children, especially children with disabilities. And a lot of the brouhaha that has occurred in DC has been about funding Medi-Cal. And when you cut back on Medi-Cal, it reduces health care for the needy. Now, the cost to the users. Medicare has premiums, deductibles, and copays. Okay, if you were just to get the red, white, and blue card, doctors love it. They would take care of you, but there is a cost, and the cost for Medicare has no limit. And that's why there's the options out there that I'm going to discuss a little further to reduce that cost. But Medi-Cal generally has no cost to it, or it's very low. Now, some individuals, if they have Medicare and Medi-Cal, because you might have someone who has Medi-Cal, and when they turn 65, now they have Medicare. So they are considered what they call dual eligible, also known as Medi-Medis. They have Medicare and Medi-Cal. Their copays are picked up by the state. Sometimes there's a gray area where an individual qualifies for Medi-Cal, but their income is a little too high, and there's a term called share of cost. And I'm seeing it more and more now because of the restructuring of Medi-Cal in certain situations where during COVID, there was a little bit more generosity given to get people to qualify for Medi-Cal. But in the environment that we're in, every person who had Medi-Cal last year had to go through what they call a recertification process. And through that recertification process, many individuals lost Medi-Cal, or they incurred what they call a share of cost. Now, what does a share of cost mean? That means, let's say, for instance, my income is low, but in order for me to enjoy all the benefits of Medi-Cal, I am responsible in some cases for the first $500. Some people say I have a $500 share of costs. Well, that means if I want to enjoy all the benefits of Medi-Cal, any expenses that occur, I'm responsible for the first $500. That is a monthly share of cost. Okay, that's monthly. So when that situation occurs, a lot of individuals says, I better get a Medicare Advantage plan because I'm more insulated from those co-pays that I didn't experience when I had full Medi-Cal. Okay. So calculating your true cost of coverage, and I believe this is the one thing that folks don't take into consideration when they're doing retirement planning. Sometimes the cost of health care is not always factored into it, but it could be your biggest expense. So all of the IRAs and the investments that you've made often will come to offset your health care expense. So with Medicare, there's the monthly premium that we reference for your Part B premium. Depending upon where your income falls into it, you have to factor that in. Then you have your annual deductibles. So, for example, there is an annual deductible for your Part A. If you're placed in a hospital for 1 day or 60 days, it's the same copay, and it's approximately $1,700. With your Part B, there's also an annual deductible. That's roughly $255. So the first time you see a doctor, you're going to pay $255, and then thereafter, after you hit those deductibles, then you have copays. Medicare covers 80%. You're responsible for 20%. So when you look at it, that can be very costly because there's no ceiling on the amount that you would pay in a year where you are experiencing a lot of health related issues. So in order to defend and protect your income and expense, a lot of people look at other options that will partner up with Medicare. But keep in mind, you have to be compliant in enrolling in your Part B and Part D when it's timely, because that will trigger excessive expense because of late enrollment penalty. I like to give examples. I met with someone who said they were in good health, didn't need to get a Part D. All of a sudden, they incurred an illness that had a very expensive prescription drug associated with the cure or treatment of this disease. The medication was over $3,000 a month. They could not run fast enough to get a Part D prescription drug plan. First of all, they were out of the enrollment period, because the enrollment period is only from October 15th through December 7th. So they were out of luck. And then it was determined that they had gone 5 years without having a Part D. So for every month that you go without a prescription drug plan, it's roughly 40 cents a month. You multiply that 40 cents a month times 12 times 5. That was the penalty. Now, that's not a one-time penalty. That is a monthly penalty that that person will have for the rest of their life. Medicare is unforgiving. So, what are my options? When you look at Medicare, you can go with the original Medicare, and I've had conversations with individual that says absolutely no HMO, no PPO. I want the original Medicare. I want to be able to pick and choose the doctors, and I don't want to wait for referrals. Well, that's great. You know, there's options out there for you. So when you get the original Medicare, as I said before, there is no limit to the co-pays that you can pay. 80-20, 20% on a major illness could really be expensive. So one of the ways that you can offset those co-pays and deductible is to get a Medicare supplement, which is known as a Medigap. This is a standalone insurance policy that you would select to get. And there's different options. The most comprehensive one that's available now is what they call Plan G. That's G as in George. It covers everything, and the only thing you pay with that is a Part B deductible, an annual deductible of about $255. Once you hit that, you present your Medicare card, and then you present your Med supplement. The doctor bills Medicare for the whole thing, and then Medicare says, oh, no. I only pay 80%. So that 20% comes back to the beneficiary, but the beneficiary says, I have a Med supplement. So the doctor would then charge whatever Medicare doesn't pay, they would then charge to the Med supplement. Great. Now, for that privilege, it doesn't come without a cost. So you're going to pay for your Part B premium, and then you're going to pay for the premium associated with the Medicare supplement, which is based upon attained age. So guess what? When you're young, it's a lot more affordable than as you get older. I've had a lot of people says I'm going to the Med supplement, and as they get older and that premium starts to go up, I get calls saying, you know that HMO I said no to a couple years ago? Well, I'm going to consider it now. So it's an adjustment. It's what you can afford. So in addition to the Med supplement, there's that Part D. You have to get a prescription drug plan. And there are some changes that has occurred to the prescription drug plan. At one time, they had 4 different stages, and it was the 3rd stage that really sent a lot of seniors to the poorhouse. It was called the donut hole or the coverage gap. During that period, seniors would be paying an enormous amount for the cost of their medication until they hit a certain dollar amount out of pocket. Well, thank goodness through the act that Biden put in, it was called the, what is that called? It had to do with reducing the cost of the medication for seniors. No senior this year will pay more than $2,100 for the cost of their medication, regardless of what it is. It could be blood thinners such as Eliquis, Xarelto, Ozempic, Humira, all those expensive drugs. Once they hit $2,100, their financial responsibilities stop, and the insurance company have to pick up the cost of it. So that is what you're looking at. I call that the a la carte of Medicare, but the most freedom one could have. There is no networks, there's no referrals. The doctor bills Medicare directly. So there's no insurance company involved. But there is insurance for the Part D. You have to go through the insurance company to get a prescription drug plan. Now, the other alternative is the Medicare Advantage plan, which is also known as Part C. That's when you have a lot of players like United, Scan, Humana. Most of the plans are designed very similar, but some of the benefits could have co-pays, some of them don't. There's a max amount of pocket. And the reason why people gravitate to the Medicare Advantage plans is because of the predictability and the additional benefits. I have a running joke that Medicare does not cover ears, eyes, or teeth as it pertains to the aging process. So if you can't see, can't chew, can't hear, that's okay. You know, it's not covered through Medicare unless it's medically necessary. under the Medicare Advantage plans, what makes them competitive because many of them provide those benefits that is not covered in a traditional Medicare plan. They also have the predictability of knowing how much I'm going to pay in case I have a catastrophic illnesses. There's some plans out there that have the max amount of pocket as low as $199, and that includes doctor visits, hospital stays, if they're going to skilled nursing. So that's all included in there. I'm going to turn it over to Clifford right now, and he's going to explain this beautiful graph that's here.
So as I mentioned a little bit earlier in the beginning, our website is myhealth-wealth.info. It was Vanessa's brainchild. And there is an intersection between health and wealth because you need to be able to afford your health care. And as it says up in the upper right-hand corner, you want to protect your retirement savings from catastrophic medical bills. And as Vanessa had mentioned, there are some plans that have a maximum out-of-pocket. So you want to protect yourself from your out-of-pocket expenses. So on the left-hand side, you want to get your access to all your specialists and all your care. But on the right-hand side, you want to make sure that you're not having a $7,600 maximum out-of-pocket where you could have it $199. So that's where we come together with Seymour Insurance Services, and we help you navigate, through the maze of which plan is the best for you. So that's where we have the intersection of health and wealth. So now, as we discussed, you want to protect your wealth by securing your health. And now what we can do is, if you have any questions, we can start thinking about that. The next thing for you to do is, as people are turning 65, or as every year when plans change, get with us and we can schedule a strategy session and look at, like Vanessa said, between a Medigap and a Medicare Advantage. Because the key is you want to avoid any late enrollment penalties, because people are turning 65 every day and they can get lost in the maze of the changes. And here's the different ways to contact us: through our phone, our email, the myhealth-wealth.info, our website, our Facebook page, and also our YouTube page. So now we kind of open it up to any questions.
Thank you, Vanessa and Cliff. We appreciate that wealth of information, pun intended. Any of our guests have any questions about how to navigate Medicare costs? There's a lot of information, so feel free to ask.
I'll probably have to make an appointment.
Okay, all right.
Specific questions.
Okay.
I would agree. It is very specialized because not everyone have the same set of circumstances.
Yeah, thank you.
And Vanessa, you said something about early on, you said if you have an offspring, does that mean a dependent dependent offspring?
Okay, what it is, if you have an offspring that has a disability, such as if they have Down syndrome, autism, mental retardation, they have to have the diagnosis before the age of 18. And if when you apply for Medicare and or Social Security, there's a couple questions they ask you. They ask you about marriage, and they ask you about any children you might have with disabilities, because they take all that into consideration when they are going through the enrollment process with you.
Oh, okay. All right. Yeah, I have a friend who might need that information, so thank you.
Hello.
Hi, Tracy.
Hi, how you doing?
Good. Thanks for coming.
You're welcome. Glad to be here. I have a question about the parts. Um, from listening to the presentation, Part C is a all-in-one, right?
That is correct. It includes all the aspects of Medicare.
Except for Part B.
No, it includes Part D. That's where
It
there's a
does include Part
it
B.
does include Part D. Now, let me
Okay.
just throw one caveat out there. There are some plans out there that, and I'll use especially for the military. They
Mm-hmm.
have plans out there that does not include prescription drug plan, but that's by design because
Okay.
a lot of veterans get their medications through the VA, and
I s-
so they design these plans for veterans. But under normal circumstances, it does include the prescription drug plan, and that's what makes it affordable. Um, we can have a one-on-one, but when I go through the prescription drug standalone plans, they're very expensive, very, very expensive, and it's cheaper to have it through the Medicare Advantage plan.
I
But
see.
what you want to do is you want to make sure that if you're receiving treatment from any doctor, that the doctor that you're receiving care from is in the network, and it's an exercise that we do.
Okay. Got it. Thank you.
You're very welcome.
All right. Elena?
Hi, I have a question. There are many Social Security recipients who took early Social Security because they were caregivers or other reasons.
Yes.
And as the income, their income is less than what it would have been, it doesn't change. But the cost of the Medicare keeps going up. Does that mean that down the line they could maybe then change over to Medi-Cal if they qualify or find themselves needing,
Okay.
you know, an advantage plan, and then can they take that lower later but not get a penalty?
Well, let me see if I can paraphrase what you're saying. First of all, when someone take their Social Security ahead of time, the haircut could be anywhere from 30%. The most is going to be 30%. And then each year that they delay, it does get smaller. But let's say, for instance, they did that. And they're now eligible for Medicare. What happens is, although you took your Social Security at an early age, you still get the increases every year. So as the income goes up, the requirements for Medi-Cal sometimes go up, sometimes it stays the same. So each year you're almost getting away from being Medi-Cal eligible. However, I would not let that deter them because there's three levels of assistance that is available to people. Okay, first it's Medi-Cal with full benefits. Then there is what they call Medicare savings. And sometimes the Medicare savings is a huge benefit. That means that their income is higher than what is Medi-Cal is expected, but they are eligible to have that Part B premium picked up by the state. So when I have conversations with individuals, I don't ask them about their income, but I said, if your income is this amount or lower, you might be eligible for the three layers of assistance. One is full dual, the other one is Medicare savings, and the other one is extra help. And I go through that with them. So if you know someone that falls into that category, because you're absolutely right, a lot of people have drawn on their Social Security early because they had to provide care for a loved one. Okay. And I've seen this happen that they're Medi-Cal eligible. Now they have a very small pension that's in the wings. They start to tap into that pension, and guess what? It's just enough to throw them off of Medi-Cal. So everything is very strategic.
Thank you.
But if you have questions that is more on a personal basis, feel free to give us a call. We do a lot of this by Zoom. We come to your home. It's what you're comfortable at. I've had individuals who was on Medicare for years, and after having a conversation with me, one of the plans that we partner with will actually take the application by phone to see if they qualify for any of those tiers of assistance. And it was determined that they were eligible. They had been paying more than what they should have, and they were eligible. So they were able to get some of the entitlements.
All right, thank you, Vanessa. Any closing comments that you want to make about this topic?
I would consider healthcare should be part of your retirement planning. A lot of people feel that, well, I don't have a lot of assets, so there's really no planning. It is planning. If you have any monies in a 401k, be mindful that if you take a little bit out of there, it can throw you into IRMA. So just know where the triggers are and dance around the guidelines.
Okay, thank you. And of course, make an appointment for a strategy session so you can get your situation figured out and make the best decision for you. All right. Thank you so much, Vanessa Seymour and Cliff Seymour, for this presentation.
It's a
Super
pleasure.
helpful. And we appreciate everyone who has been able to join us and hope you got some great information. And again, check out the LA South Chamber of Commerce for all kinds of business information and business tips that can help you and or a loved one or a friend. All right, so that'll do it for this evening, and we will see you another time. Thank you. Good night.
Good night. Thank you.
Mhm.